I am Director Tony Lopez, your moderator for today. May I now call on our President, Peter Manzano, to please call the meeting to order.
Thank you, Director Tony. Good afternoon, fellow Rotarians, our lovely aunts and guests. I now call this 29th regular meeting of the Rotary Club of Makati to order.
President Peter. Well, we're getting to the heart of the meeting. May I call on Past President Eddie Yap to please properly.
Good afternoon, my fellow Rotarians and friends. It has been a continuous stream of dreary and sad developments in this time of COVID pandemic. Yet we have many reasons to be thankful to the good Lord Almighty. We are safe and here together in fellowship in this spiritual meeting. This afternoon, I have the pleasant task of introducing our guest of honor and speaker. Since he took office barely a month ago as the new chairman of the Metro Manila Development Authority, he was immediately confronted with a stream of challenges other than what his office usually is charged with. First, it was the long-anticipated vaccine rollout, then the latest big surge in COVID cases, and how to confront it in concert with the mayors of the metropolis. But despite all this, our guest speaker graciously found time to be with us. A cursory look at his profile will show that he belongs to a new breed of servant leaders that will define our country's future and a man to watch in our political firmament. His stewardship of Mandaluyong as city mayor saw its great transformation into the Tiger City of the Philippines. From a low-ranking residential and factory town, Mandaluyong was transformed into a dynamic city with huge mixed-use residential and commercial complexes, which are among the largest and most modern in the country. In Mandaluyong, the Ease of Doing Business Act is not needed because one can do business with ease in Mandaluyong, not out of compulsion, but because that is in the nature of the leadership of the city. Matulungin, may malasakit, service with a smile. The name of our speaker echoes the essence of leadership, service, dedication, and compassion. With his pioneering efforts, Mandaluyong received numerous awards, and to name just a few, the prestigious 2015 United Nations Public Service Award, the Local Government Leadership Award, Presidential Award for Most Child-Friendly City, two of the top 10 prestigious Galing Pook Awards of 2013. And Mandaluyong was rated the most business-friendly city in the Philippines, ranked number 2 in top performing cities based on locally generated revenues. In 2015, the city achieved the Guinness World Records for the largest Zumba class in one location. It garnered the seal of good local governance conferred by the DILG. and he is a pioneering leader in green building program. This is just among the many others. And what is most remarkable, while he was achieving all of these accomplishments, he served in concurrent capacity as president uh, of the League of Cities of the Philippines, the Union of Local Authorities of the Philippines, and then pioneered in innovative ordinances in the city. Not only is he the guiding force of the city, he is likewise the source of inspiration to serve for every Mandaleño. The man behind the organ, deeds not words, gawa, hindi salita. Truly, our speaker, as chairman of the MMDA, will bring new life and dynamism to this most important office. Fellow Rotarians and friends, it is truly a pleasure to introduce a personal friend, the Honorable Benjamin Benhur Abalos, Chairman of the Metro Manila Development Authority. Let us all welcome him.
Thank you so much, Sir, Mr. Eddie Yap, Vice President. Is just like an uncle to me. And of course, Mr. Peter Manzano, the President of Rotary Makati, Mr. Tony Lopez, our moderator for today, Rotary aunts, officers, ladies and gentlemen, good afternoon to everyone. I would like to present to you some of the pictures and data about MMDA. Please. Okay. Metro Manila Commission started in November 7, 1975. And the first governor of Metro Manila Commission then was First Lady Imelda Marcos. However, after People Power, the MMA was created during the transition period. And all of the mayors of Metro Manila became the chairman every 6 months. After the transition period on March 1, 1995, MMDA was created under Republic Act number 7924. Next. If you will see here, there are only 7 mandates of the MMDA: development planning, traffic and transport management, solid waste disposal and management, flood control, renewal, health and sanitation, urban protection, and pollution control, and of course, number 7, public safety. Next, please. Okay. These are more or less the efforts of the department, of the agency in the national level. It's basically the Opland Command Center, under which we've got Opland Kalinga, and then the aggressive community testing, the contact tracing, and then the second part is a transportation support. Of course, this Libreng Sakay and the MRT and the bike lending for the frontliners. Next, please. Okay. Now, let me start first with this One Hospital Command. This One Hospital Command is a joint project of the BCDA, of the Department of Health, and the Department of Tourism. This one, the aim of this One Hospital Command is really to compile all calls from different. Okay, I'm sorry, we're having some technical difficulties with our Wi-Fi in the agency. I really apologize for this. Okay, just to continue with our hospital command. So far, ever since this was created, this concept was created, we've got 26,000 calls received since August of 2020. On the average, we receive 299 calls every day. The internet is really malfunctioning here. Okay. Now, let's go now to Oplan Kalinga. Another program that MMDA has really joined with the national agency, with BCDA and the National Task Force and the DOH is called Oplan Kalinga. What is Oplan Kalinga? Oplan Kalinga is all about isolation centers using hotels for asymptomatic patients. Rhea, please. Next. So far, we've got 35,000 persons who we place into different hotels. This is the data as of April 12, 2021. And these are the hotels that actually it's the Office of the Civilian Defense who agreed to have contracts with the hotels. MMDA is just supporting them. And right now, this project is still continuing. And not only that, we've got also temporary treatment and monitoring facilities. What are these? These are for positive symptomatic patients, which needs to be monitored by doctors and nurses. So we've got several sites for them. We've got the BRP ang Pangulo, Philinvestment, PICC, Ultra Field Sports Arena, and these are just huge facilities. So these are some of the facilities which are being used for these temporary treatment facilities. And of course, when it comes to contact tracing, the local government units are very involved here. This is one of the key ingredients right now. Before, it was the DILG who was given the budget under Bayanihan 2. If I'm not mistaken, about 15,000 contact tracers at that time were hired, to about 20,000 were hired by the DILG and given to the local government units. However, about 2 months ago, all of this stopped. So there was quite a problem then. So because of this, our agency has to find funds, and we have allocated 600 contact tracers for the LGUs of Metro Manila, the Philippine National Police 362 contact tracers, and not only that, about 3 days ago, I was able, Secretary Bello of the Department of Labor called me up and told me, Mayor, we're going to help you by providing 5,000 contact tracers. And after a while, he called me up again. I told him, Secretary Bello, we need more. So he told me, okay, 14,000 contact tracers, or the amount of about 230 million for 10 days. But I told him, it's okay, give us that amount. But instead of 10 days, we're going to stretch it instead to 3 months for the whole of Metro Manila. So what we have right now is 14,000 contact tracers given by DOLE, and they will be starting 2 days from now at a minimum rate of about 537 pesos per person. So more or less, this is these are the contact tracing done so far in Metro Manila. Just look at the figures here. For April 9 alone, it's about 1.48 million. And for March 28 is about 1.3 million. These are the contact tracing done by the local government units. We are just coordinating with each and every city and municipality and trying to compile this and help them in whatever way we can. And not only that, aggressive community testing. Again, since we are just coordinating with the LGUs and with the national government, we sought assistance from the national government about PCR swabbing and testing, targeting those whose families tested, a member of the family tested for COVID. So we have to test all those who were near with him. And because of this, Secretary Vince Dizon gave us at first 50,000 test kits. Probably this is worth about 200 million. These are PCR swabbing. And just about 3 days ago, he gave the National Capital Region another 25,000 worth of test kits. These are some of these transportation assistance that the agency has provided. Of course, to the Libreng Sakay for the health workers, Analyze MRT bus augmentation system, and our bike lending program for the frontliners. And so, letter B, let's go to the more or less to the heart of what we're doing here. It is really coordinating with the local government units of Metro Manila. But what is very important here, as you will know, is that each and every city in Metro Manila, they are autonomous under the local government code. What does it mean? It means they could enact their own laws. It means they can stand on their own. It means they can have their own policy. The secret here is having one policy for the whole of Metro Manila. Why? Because our borders are very porous. It's important to have one voice in every major policy, especially now during the pandemic. And so far, all of the Metro Manila mayors has agreed to have one voice. And not only that, MMDA monitors the LGU's COVID efforts. We also provide inputs for the approval of granular lockdowns. And of course, aside from supporting their autonomy. Okay. This is just some of the regular meetings we have with the mayors and with the national agency. Actually, we always do this almost now about 3 times, every 3 days, 3 times a week for that. And these are just some of the resolution that we have had where we voted as one. For example, if you will recall last March 11, we've seen an upsurge in Metro Manila. That is why on March 11, on its own, Metro Manila had a curfew of up to 10 p.m. No, and not only that, we on March 15 also we set the age from 15 to 65. Usually the age is from 18. We made it stricter for Metro Manila at that time. But after, if I'm not mistaken, after about 5 days, ECQ, or after 10 days, ECQ was then implemented. And not only that, on March 23, if you will recall, the whole of Metro Manila mayors voted that we were then against the opening of the cinemas, the spas, and the internet. Again, these are 3 prime examples of how the Metro Manila mayors and all of the cities and municipalities of Metro Manila can really have their own policy and really vote as one. And lastly, just about yesterday or the other day, they also voted that the curfew in Metro Manila will not anymore be 6 o'clock. It will be between 8 to 5 in the morning. Now, let's go to the COVID situation report in Metro Manila as compiled by our agencies. So these are the active cases, the deaths, and the total cases. These are some of the isolation facilities which we are coordinating with each and every cities in Metro Manila. So we've got a list of all of these isolation facilities. And if in the event they are fully occupied, what we do is through our Oplan Kalinga, we support them. We bring some of them to the hotels that is being managed by our agency, by MMDA. And when it comes to vaccination efforts, we also coordinate with the National Task Force, with the Department of Health, together with the needs of each and every mayors of Metro Manila. So far, this is how it looks on the ground. Really very orderly. I'll give you later data on how vaccination is going on in Metro Manila. Just some of the pictures here. So as you will see, these are different cities in Metro Manila. So let's go through this table. If you will see the first dose of overall total, the first dose, it's already 98%. See? So there are 2 doses. It's CoronaVac or Sinovac and also AstraZeneca. So this is only for A1. A1 are those who are medical frontliners. As far as medical frontliners, it is already 98%. We'll still have to get the data about the senior citizens and also about the A3, which is the person with comorbidities. Now, let's go to the ayuda. This is a very hot topic right now because the mayors were only given 15 days by DILG to give this ayuda or financial support to each and every constituent. However, what is difficult on the ground is if ever we have to finish in 15 days, those who have big constituency like Quezon City, Manila, they might find it hard because sometimes there will be overcrowding in different areas. But if they're going to go through house to house, it will take a long time. So far, what we're trying to do is meet with the mayors and just look at the flow, how effective it is. And probably after 3 days of assessment, what we could do is, again, ask the ILG if ever there will be extension or not. But as of now, we're still monitoring the developments of the ayuda on the ground. Now, we've also written a letter to Secretary Briones requesting that since Auckland Kalinga, we're spending so much for the hotels, no, the government spending so much. If probably what DepEd could do is lend us some more schools, and gladly Secretary Briones told us, mayors, you could make use of the other schools of DepEd provided you follow 3 conditions. Number 1, it could only be used as a last resort. Number 2, it should really only be used for vaccination, or aside from vaccination, you could use it for testing. However, if you're going to use it for vaccination, you could use it for no other more purpose. No, it's written there. So what happened here is that the Secretary Briones National Agency really helped us a lot. But aside from this, I would also like to thank Senator Gordon and the Red Cross, because those other schools that we have, they will provide for the beds, and he told me ambulances, nurses, and even doctors, so that we could have them as our isolation facilities. Okay, now, ways forward. Further use of schools as isolation facilities in coordination with the DepEd. Assistance to 17 LGUs in putting up additional isolation facility through the Red Cross, and the partnership with the private sector for the expansion of ICU in Metro Manila. The third one, we discussed this 2 weeks ago with the Department of Health. Right now, our hospitals are overwhelmed with patients. So Secretary Duque and, if I'm not mistaken, Secretary Vince Dison had a meeting with the mayors, of which the MMDA arranged, together with the private sector, Mr. Borromeo and Mr. Bill Luz. And we are targeting right now that the ICU of government-run hospital, I'm talking of LGU hospital, be expanded. We're trying to reach a target. Like, for example, in Mandaluyong, right now, we only have 3 ICUs. We're planning to expand our ICU to 8. We have written down the things that we need, no? Even just high flow things and ventilators, but really what we need are manpower. And so, according to Secretary Vega of DOH, they would help us in trying to find the most important element here, which is manpower, nurses. And what is good is the private already came in also to help. Okay. Now, let's look at this Pasay experience. This is a very interesting experience as far as I'm concerned. Last February 22, we were asked if probably what we feel if the whole of NCR is ready for GCQ, and for modified GCQ. We told them we're ready. Because why? At that time, there were only 5 patients in our isolation room. Only 5 in Auckland Kalinga, 5. And all of the data, it's going down, really. The cases are going down. February 22, I remember that very well. But that suggestion of ours really was vetoed by the president. And he told us that we cannot, it should be always remain as GCQ. But after 5 days, from February 22, strangely, the cases of Pasay City went up. not only, it really dramatically surged, doubled, no? And you could see the data there. It's really doubled. So Mayor Emmy called me up. Chairman, I need your help. So we coordinated with the national government. Pasay had 6,400 swabbing, up to 17,000 swabbing on March. You could just imagine, no? The contact tracing from 7,000 to just 30,000. And the lockdowns, Pasay had granular lockdowns of 136. Streets, barangays were really locked down, and the good mayor has to provide for the meals and grocery. And you know what's the cause? Part of the cause are the variants at that time. I'm going to show you now the data of Pasay. This is the data. Look at this. It really went up on March 21. But however, slowly, it has been going down. And this is the latest April 11. These are the data we compiled. Why am I telling you this, Rotarians? All of the efforts that the LGU, the help of MMDA, everyone in Pasay, this could be a learning experience for everyone. And this is what everyone in the NCR is doing right now. Mahirap po talaga, hindi ho biro when you're on the ground. Talagang napakahirap. But through this tremendous effort, at least this is the silver lining. Maski na tumataas pa rin, sabihin natin tumataas ng konti, pero nakita naman po natin through this data, it's really going down. And so the secret here, I think, it's our policy of voting as one. In Metro Manila, cities like Quezon City, Manila, even Caloocan, they're huge. They've got large constituencies. Their vote is just as equal as that of Pateros, nakokonti lang Mandaluyong, or even San Juan. Where respect is important, where being one is very important, especially now at a time of crisis. And for me, that is our bigger role in MMDA. Even though we're just coordinators of making sure that there will be one policy in Metro Manila. Okay. If you will give me time, what I could do is, Mr. Lopez,
Yes, yes, Chairman. Yes,
can you
Chairman.
I just want to segue for a while, just 5 minutes. Can I just give you some of the upcoming projects of Metro Manila while
Please
we're
go
here?
ahead. Please go ahead, Mr.
Okay.
Chairman.
Because I see Mr. Palafox on the screen, and he's a good friend, one of the best planners. So I just show you some of the things that we've done and we're planning to do in Metro Manila. Okay. Okay. Wala pa. Can you see it in the screen?
We can only see a file screen, Mr. Chairman, open.
Can you recognize our co-host, Ms. Rivera, the file sharer, Ms. Rhea Rivera? Share screen, please.
Ron?
Already a co-host, sir.
Okay. Okay.
Go ahead, Mr. Chairman.
Yes, sir. I took office just last January 21. Okay. So the first thing I did was coordinate and take stock of inventory our manpower here. Right now, we've got 25% of our traffic enforcers are senior citizens. That's the problem. We've got no visibility on the streets. So we immediately hired 1,000 enforcers. And to those who are senior citizens, we asked them if those who could work at home, okay, but those who would rather retire early, we gave them early retirement with the promise of hiring any one of the relatives, even those recommendees of theirs. So I immediately went around and met my bosses, the mayors of Metro Manila, and even those from the national governments to make sure that all of the projects of the national will be harmonized with those of the mayors of the LGUs. And these are some of the things that for housekeeping, we've got this also our hospital command here. We've got our own isolation facilities. And tomorrow we will be having vaccination for all our traffic enforcers and for all employees of MMDA. And of course, this is the one hospital command. And this will be the new building of MMDA. This will be on Ortiga Street. We have an old building here. It's about, if I'm not mistaken, a 30-year-old, 40-year-old building. Now, we're going to upgrade all of the pumping stations of MMDA. This is an AIIB project together with the World Bank project. And this is really, I would like to congratulate Mr. Eddie Yap for this. Is here. He's the one who thought of this bus carousel system. It really worked for Metro Manila. But however, when I took office, there was one problem. The U-turns here, the U-turns. If you will see, there tend to be traffic at the U-turns because when they close the slots, all of those, they cannot U-turn anymore and they have to find further areas where they could have U-turns. So what we plan to do is have this one. It's called the elevated bus ramp. When I came into office, it was January 21. So I tried to have an immediate design of this, tried to have this, the procurement and the bidding of this. I would like to speed this up because this will be a solution to this traffic. So if you will see in the picture, the buses will just go through this elevated ramp so that freeing those underneath where private vehicles could now have a U-turn. And we're also going to have this bike sharing program together with the Department of Transportation in Metro Manila. And also this Metropolitan Bicycle Network. If you could see, this is a project with Department of Transportation and Department of Public Works. All of those lanes in the map are now being constructed. We have made studies about these bicycle networks. And this is an elevated walkway and the bicycle lane, which we are proposing to the national government. Although the funds are not yet secured, we are pushing through and asking them if we could, we are pushing this idea about this elevated walkway and bicycle lane in EDSA. And also, right now, the Metro Manila Intelligent Transport System, we're really upgrading our existing traffic signals so that everything will just be through this system, everything. Now, if we're talking of mobility, it's not only about MRT, LRT, or even the buses. Those are the most important things. But if there's one thing we should also concentrate, it's travel using our own water system. So we took a stock of how many ferry we have right now. We're going to add, and right now this is this existing ferry route. It's just along the Pasig River. However, we are now going to add, it's not only the Pasig River, the one in blue, but we now have the Cavite to Rojas Boulevard ferry system. And what we intend to do is build a station at Intramuros, and then through it, you could now use the Pasig River, the blue lane, and you could go up to Marikina. It will service our constituency even up to San Mateo and even Rodriguez, and go straight down Laguna Lake using Taguig. We've already met the president of the Laguna Lake Development Authority, Chairman Medina, about this. and possibly link this up with Cardona, even all the way to Calamba later on. But what is important is building more or less a repair shop in Dalapindan where we could repair our ferry. So these are the ferries that we have, and we've acquired several more. What is important is we've got a regular hours, every 30 minutes they should travel. So this is now being undertaken. Now, look at this Parañaque spillway. I'm sure architect Paula Fox knows this, because I've read that there was this Parañaque spillway. Because if we're going to look at flooding in Metro Manila, almost everything comes from the Sierra Madre mountain range. And from the Sierra Madre mountain range, it spills now to two bays. Number one is the Laguna de Bay, and the other one is the Manila Bay. The problem with the Laguna Bay is that it just got stuck there. The water is just stuck there. But it's really hard to have a Parañaque spillway right now. Why? Because of the commercial areas, because of the residential areas. But right now, we've got a subway being constructed, and there is this board treading machine, the big ones. So what I was thinking of, why not use this to go underneath the national roads like Sukat? And so probably this Parañaque spillway, but using the technology of the subway and using the national roads, this idea could probably be the solution to flooding of Metro Manila. Now, this is our Metro Manila Solid Waste Management Plan. We plan to do this because each LGUs have their own plans. What we want to do is have one for the whole of Metro Manila, integrated and centralized, everything. Right now, we are operating this. These are the solid waste granulator operations. These are near the pumping stations, because in the pumping stations, there are some waste generated, and this waste cause damage to the pumping station. We're able to get hold of this waste. Some we make into fertilizers, others into these products like the hollow blocks, bricks, and the concrete barriers. And this one is just a small truck. What is this? Is people can go here, exchange their garbage for canned goods, for groceries, for rice. So we're trying to replicate this, bring this to every barangay in Metro Manila, so that on their own, the LGUs can replicate it there in their every barangay. Now, this is a perennial problem. Water lily, this water hyacinth is a perennial problem. What we intend to do is gather them, and water lilies have one strong quality, the one in the middle. It's just like plastic, slow burning. You could actually just shred them and then form them into briquettes, charcoal briquettes, and sell them into energy. It's being done right now. What we intend to do is really do this and give this to the small communities, this technology to the small communities along the Pasig River, so that we could give industries to them, and of course, we could transfer the technology to them. What I found out about MMDA is that we don't have our own landfill. All of the three landfills, I'm talking of Rizal, Navotas, and San Mateo, are owned private. So I was telling my staff, why can't we just buy on our own? But of course, the problem is no one wants it. The thing is, we must make it palatable to the host LGU. That's why I'm telling my staff, let's study this very well. Study the energy, the garbage to energy programs, and study ways of transportation. We could make use of boats or even railways. Just try to find out what is important is MMDA. The government should have its own sanitary landfill. And lastly, this is what I intend to do. Get the blighted areas in Metro Manila and transfer them into open spaces, green parks. I already made a survey. I asked my technical people to go around and try to give. We're going to offer money, not only to transform this blighted area into greeneries where we could give even 24-hour Wi-Fi so that people can just gather. If we're going to look at all of this, what we're fighting for is against urban decay of Metro Manila. Clean water, fresher air, uh, mobility, and of course, the greening of Metro Manila. So with this, I'm sorry for the technical difficulties. This is more or less my presentation for the pandemic and some of the projects of MMDA. Maraming salamat
Thank,
po.
thank you, Chairman Abalos, for your thorough presentation, particularly your last one on the recycling of waste, waste management, and open parks. Your internet connection is better now. Can you spare a few minutes to entertain some questions, Mr. Chairman?
Yes, sir. Yes, sir.
Okay, I will. I have so far gotten from the chat box a few questions, but let me start off first with PP Eddie Yap. Just on his response on the elevated EDSA ramp. PP Eddie, can you share something with us on the U-turn elevated ramp?
Yes, actually, that is a very good solution. In fact, before Chairman Abalos came into office, we were talking about that, and I submitted a perspective of that overpass because we were made aware that the closure of the U-turn slots caused a lot of traffic problems and affected people and businesses in that sector. Actually, I informed the traffic managers of MMDA that busway standards under the ITDP allows for intersections, supervised intersection. They need not be closed. Some may be open, but with supervised traffic. But the overpass is the best solution because that will allow buses on the busway to run continuously without disrupting vehicles from making their U-turn underneath. So Chairman Abalos is on the right track there. I support him completely on that.
Thank you. Thank you, PP Eddie. Now I have a question from, yes, go ahead, the chairman.
I would just like to make a comment. No, the supervised overpass, as suggested by Mr. Ediap, really worked for us. Really worked for us. During the time when this problem about U-turn slots being closed, we used that kind of a system, as suggested by Mr. Ediap, the supervised overpass. It really worked, but of course, what is important is later on we will have an elevated bus ramp. Maraming salamat po, Mr. Ediap. Thank you.
Salamat
Okay,
po.
okay. The next question is from past President Junjun David. First, he has a suggestion, Mr. Chairman, that for your contact numbers, maybe you could use shortened numbers like 911 or memorable numbers like MMDA 911. And his question is regarding the lockdown. I don't know if this is for you or for the IATF, but regarding the lockdown, has a serious study been made whether lockdowns actually reduce the rate of infection? Did you hear that, Mr. Chairman? Whether
Yes.
lockdowns actually reduce the, although you had an example of Pasay, maybe you can expound on that, yes.
Well, yes, sir. Actually, in the IATF, it's actually composed of all of the secretaries of the president. No? You've got basically the economic team and also the health team. No? When they make a decision, they always balance everything. But in my experience, in my short experience as the chairman of MMDA, I've seen these granular lockdowns made all over. And I think it's very, very effective, the granular lockdown. Although it's really is a burden to the local LGU. Why? Granular lockdowns means if you've got the cluster of cases in certain areas, you could close down a street, you could even close down a barangay, and if you've got a healthy population, you could allow that healthy population to just work, to just go out. In so doing, you're able to isolate. No? Pasay has been doing that, really, because Pasay is the first LGU that experienced this South African variant and UK variant. The Genome Center could prove this out. However, of course, because of the spread of Pasay to other LGUs, the numbers came coming in very quickly, in just 2 weeks, in just 3 weeks. And so our health workers called for a timeout. That's why we've got the ECQ. And according to Okta, to the DOH, it really worked, and we must wait for 2 more weeks about this. No? But the way I see things, these are the things being done all over the world right now. No? I'm not a doctor, I'm just an observer. Our job is not just to coordinate between the national and the local. We're always on the ground. But that's why I presented to you the Pasay experience. Because Pasay, it is where it all started. And right now, the numbers are very encouraging. One thing I could tell you is that I think before they reach into any kind of a decision here, the health team together, even us in the, okay, let's not talk anymore of IATF. Let's just talk of the mayors now. Because with the mayors, I'm more with them, with the Metro Manila. We always get advice not only from DOH but also from Okta Research and the others, and we also get advice on the economic side from Secretary Carl Chua, Mon Lopez. We try to weigh, to calibrate health and economy. No? So if you will see the 4 resolutions that the mayors had, those are all based on the studies of experts. I'm sure IATF also does that. Thank you, Mr. Lopez.
Okay. There is a question, Mr. Chairman, from our President-elect Louis Asoeche. He said, how safe would it be to allow cyclists on our roads? Should we not provide dedicated lanes like in EDSA? But wouldn't those dedicated lanes add more to the traffic congestion?
Okay. It's actually these things. Now, number one, with reference to those projects, these are the projects of Department of Transportation and the Department of Public Works. I told them we're only going to allow it provided 2 conditions. Number one, they must conform with the international safety standards. That's number one. Number two, if ever traffic will really be terrible in that area, you must make sure that these things could be transferred. They are transferable so that there will be no waste of people's money. So if ever, let's say right now, we're in the period of looking at things, if it's possible, if not, if traffic will become terrible, I told them we should transfer them. So those are the 2 conditions that MMDA told them.
Okay. We have our last question from a new member, Keith Harriman from Singapore. Um, do you focus on infection rates when, as a criteria, when you declare ECQ to MECQ to DCQ? Do you monitor death rates, moving averages? What should we as ordinary citizens watch out for to expect any changing up or changing down of these categories?
Well, number one, Mr. Lopez, I'm just MMDA.
I know, I know, I know.
IATF.
I think it
Yeah,
was meant for
yeah.
IATF. But
but
maybe you can comment on infection rates, death rates, and moving averages from what you have observed lately, Mr.
yes, sir.
Chairman.
But what from what I've observed, I think it's more of the ICU right now, the critical cases. If there are so much critical cases that the hospitals cannot anymore take patients, we do not want to reach that level. So I think this is what they're trying to avoid, and this is one of the main criteria if they will call for an ECQ or a MECQ or even a GCQ. It's more of the capacity of the healthcare, sir. It's more of that.
Okay. Okay. One more question, Mr. Chairman, which is very relevant. Would you know if there are plans for more bridges in Metro Manila over the Pasig River to somehow decongest EDSA and C5? Yes.
Well, yes, a lot, sir. Sayang hindi ko lang nadala yung listahan ko. I always bring that with me, but there will be. I think the Mandaluyong Rockwell Bridge will be opened in 2 months or 3 months, and there is another one. It's the Pasig and the Makati Bridge going to C5. It will also be open, and not only that. Not only about bridges, sir. If I would recall, it's about this LRT line coming from Marcos Highway, no, to Masinag, to going to Antipolo, no? And also the one going to Bulacan, coming from Commonwealth. I think they will open it at the end of next year. There are a lot. Sayang lang po, hindi ko nadala. And there's another proposal. I think this is the proposal of Mr. Ramon Ang. It's the east to west highway, the Parex line. Now, what we have is the north to south is proposing the east to west. Napakaganda rin po ng planong yun.
Thank
There
you.
are a lot. Yes, sir.
Thank you, Chairman Abalos. Now, may I ask our President, Peter, for his response? Yes.
Mr. Tony, you think I
Yes.
can ask a question?
Sure.
Last minute question?
Sure, Past President Tito. Please, of course.
May I ask also?
Yes, PP, June.
Okay.
So
my-
let's start with
Tito.
PP
Go ahead,
Tito,
Tito.
please.
Chairman Abalos, well, this is more like a commentary, no? This is regarding on EDSA, no? Makati portion, after you pass Bundia, there is a bus lane that is present now. But that is causing, I think, a lot of traffic at the end because the buses, after they've passed Bundia, will now try to cross to go to the other side because they're going to stop by on Ayala, the corner of Ayala and EDSA. I have seen many times when cars get bottled up there, no, in entering the exclusive bus lane, and then later on at the end, okay, when they start going out towards the Ayala, the ground level on Ayala. So at the end of the day, I think that bus lane is no longer practicable because the buses themselves try to go to the other side, no? And then, as I said, because of that, it just causes bottlenecks, no? Okay, that's one. Then on the other side, on the other lane, the northbound lane, last Saturday, we almost got into an accident because the exclusive bus lane, what do you call them? Those barriers, there's no sign. And I think they took off some portions of it so that when you enter the underpass, at first you think there's no more bus lane there, but somewhere in the dark portion, the barriers start coming out. And we almost hit that because we didn't see it ahead. And we had to veer right away to avoid it. And of course, the car on the right side almost hit us, no? But I think the exclusive bus lane underneath the underpass on Ayala and EDSA, I think is no longer necessary. No, that can be. I think that can be abolished or taken out, removed. And if you have to continue it after, say past Ayala Avenue or past Pasay Road, fine, no? But underneath the underpass, I think it is counterproductive, considering that also underneath the underpass it gets constricted. So again, there is a bottleneck because of that exclusive bus lane. A 3 to 4 lane highway, EDSA, turns into only 2 lanes almost at the end of that underpass. This is just
Okay.
a commentary, an
Okay.
observation, which I hope the MMDA Traffic Bureau could study, no? Could
Thank you,
study
PP.
closely.
Thank you, PP Tito. Chairman, your response, please.
Yes, sir. Rest assured, past President Tito, I will look into this, especially the northbound with no signs. That's very dangerous. I look into this. Probably I'll give a call to Mr. Yap, or if I could get your number and report to you later. Sir.
Thank you very much, Chairman.
Thank you,
Tony,
Mr. Chairman. One more question
Tony,
from.
may I comment before
Yes,
you?
please. Yes,
Yeah.
please.
Let me comment regarding the observation of PP Tito at EDSA Ayala. Buses, after they get out of at the end of the busway, they swerve to the right to go to the bus station at EDSA Ayala. Actually, the plan is for them to go down the underpass because there is a provision for a bus station beside the MRT. Uh, the provision is for the buses to go down to the busway station beside the MRT. That is the plan of MMDA. We met on this last year, and that is what I was told. But in a way, as of now, this busway is a work in progress. There are missing sections, but we have seen the benefit of this busway to the commuters. And under the National Transportation Policy, people mobility takes precedence.
No, PP,
over
Eddie, that's fine.
vehicle.
It's
Yeah.
only this section, I think, that you should
Yes,
review.
you're right. So that's why.
I think it's working. It's working. It's laudable. But I think in this section,
Yes,
please study it carefully, because I think it is counterproductive.
yes.
Okay.
That section is still uncompleted.
Thank.
So
Yes.
let us
Yes,
allow
Mr. Chairman.
let
Yeah.
us allow MMDA to complete the busway. In fact, there are still some stations which are missing. Now, let us give the new chairman the opportunity to address these matters.
Okay, thank you, Chairman.
Okay.
Chairman Abalos, for taking note of that observation from some of our members. June Palafox, your very last question, please.
Thank you, Tony, and congratulations, thank you, Chairman Abalos. Many of these were proposed when I was team leader for the World Bank, 1974-76. Bus dedicated lanes after Curitiba, Brazil, implemented it, and Parañaque Spillway, we proposed Smart Tunnel also, and many others. I think more than 500 recommendations I can send to your office. Now the question and recommendations. During this pandemic, we donated architectural designs, converting basketball courts into COVID centers. It was gratefully appreciated by countries in 5 continents. I donated with the Department of Health. Last week, I wrote about the best practices in vaccination centers all over the world. The best is Dubai. The shopping mall are vaccination centers. So while waiting for your vaccine, you shop and dine. And after your vaccine, you can do the same. Economy is ahead. Most hygienic is Toronto. And unfortunately, people are sending me pictures of our vaccination centers. It's way, way below international standards, with all due respect. And maybe Pasig River, we had proposed 13 pedestrian bridges in so many years ago. So maybe I'll set an appointment or send to you all the
Yes, sir.
drawings, like open spaces. If you look at the 1979 zoning, there were more open spaces that were sold and approved for reclassification by local government units. Other cities in the world, as the population increases, the open spaces increase also. In Metro Manila, as the population increase, the open spaces, the lungs of the city that can improve our immune system are disappearing. So you may want to look at that, and I'll send them to your officer. And it was nice working with your father when he was chairman and working with you when you were mayor. Thank you very much for opportunity to share.
And any last words, Chairman Abalos?
Um, the comment of architect Palafox tells it all. We're really working, we should work against urban decay. That's the problem right now. Metro Manila is the economic driver of our country. And really, the enemy is urban decay. That is why I welcome all of these suggestions of architect Palafox. My term is only up to March. I only have 1 year to go, sir. But I will make sure our dream before of these open spaces, everything, we will plant the seeds already, sir. And as with reference to the parking, to the shopping malls being vaccination areas, it's now being suggested. A lot of malls, Mega Mall, Robinsons, a lot of malls are. But the problem is, sir, is the storage. Kung minsan po, the vaccines themselves, they're very, very sensitive, like the Gamaleya, and even there's one negative 70. That's the only problem. It's really the storage. In any case, Architect Palafox, maraming salamat po. Mag-usap po tayo, ha?
Okay.
Alis na ngayon ako sa posisyon. Andiyan kayo. Tulungan po tayo lahat. Thank you po. Thank you.
Okay, I cannot refuse our new awardee, George Barcelon. George, if you have to give time for our president for his response.
Yes, very short.
Please go ahead, George.
No, I just want to take the advantage of the presence of MMDA Chairman Benjur, a good friend also. Chairman, remember yung May 6, yung PCCI General Membership Meeting natin, ha? I just want to remind
Yes, sir. Yes, sir.
you. Yeah, nothing else. Thank you
Yes,
for
sir.
doing it.
Yes, sir.
A good presentation. Thank you very much.
Thank you, George.
Second,
Okay, we're running out of time.
I'm done.
Our president, please, for his response. Thank you, George. Mr. President, you're on mute, Mr. President.
Thank you, Director Tony. Last Friday, we celebrated Araw ng Kagitingan, where we honored the courage and fortitude of the soldiers who, for 3 months and despite disease, malnutrition, and limited arms and supplies, held their ground against the advancing Japanese forces. And after the surrender of over 75,000 Filipino and American soldiers, they were made to travel on foot from Maribeles, Bataan to Capas, Tarlac for 6 grueling days, where more than 21,000 of them died of exhaustion, starvation, disease, maltreatment, or outright execution by the Japanese. That's why it was called the Death March. 79 years after that harrowing war experience, our country finds itself again in another warlike situation. This time, the daunting enemies are the COVID-19 pandemic and the economic hardships and mental sufferings we all have to endure during these times. And as before, the pandemic has allowed heroism to resurface, not just from our medical practitioners, but also from our healthcare support workers, as well as those who continuously provide public service, especially in Metro Manila, like the men and women from the Metro Manila Development Authority. Yes, they too are frontliners in this new war we are fighting. And like many of our frontliners, they too are exposed every day to the virus as they continue to provide public service. It has even claimed the life of its past chairman, General Danny Lim, last January. As explained to us by our esteemed speaker, the MMDA was constituted into a special development and administrative region that performs planning, monitoring, and coordinating functions, and in the process exercises regulatory and supervisory authority over the delivery of metro-wide services within Metro Manila. The governing board and policymaking body of the MMDA is the Metro Manila Council, composed of the mayors and the cities and municipalities. The council is the policy-making body of the MMDA. It approves metro-wide plans, programs, and projects and issues rules, regulations, and resolutions deemed necessary by the MMDA. It promulgates rules and regulations and sets policies and standards for metro-wide application governing the delivery of basic services in Metro Manila. Now, having to administer a special development region and coordinate a metro-wide public service is no easy task. With 16 cities and a municipality, each having strong-willed and opinionated local chief executives, one can expect a lot of challenges from them. But when our speaker, Chairman Benjur Abalos, took up the formidable task of leading the authority in January this year, a lot of the mayors in Metro Manila welcomed him with open hearts and minds. That's because our chairman has himself been a long-time local chief executive, having led the city of Mandaluyong for 15 years. He knows the challenges the citizens of Metro Manila face every day, and he knows how to deal with them effectively, as clearly seen in his moving forward programs for this year. More than transport, traffic, and solid waste management, which are themselves already Herculean tasks, the MMDA performs other crucial functions like responding to the natural disasters by providing rescue, clearing, and rehabilitation assistance, and working hand in hand with the authorities and local government units in mitigating the ill effects of the pandemic, like the One Hospital, Oplan Kalinga, contact tracing, and aggressive community testing projects, to name some of the MMDA. With the chairman's self-imposed mandate of transparency and output-based performance during his term, underscoring the importance of discipline and attitude in making sure that policies are effectively enforced, we are confident we will have an MMDA that is well managed and a region that is led in the right direction. Besides, wherever he goes, he carries with him his slogan and brand of public service, gawa, hindi salita, as mentioned earlier by PP Eddie. I believe this is the best way to honor the brave men and women of the MMDA who tirelessly and unselfishly go out every day providing services in Metro Manila. Thank you, Chairman Benjur Abalos, for sharing with us your time and your valuable insights on the MMDA in the time of COVID-19 pandemic. So on behalf of the Rotary Club of Makati, our lovely aunts, our district governor Chacha Camacho, the other Rotarians from the different Rotary clubs in our district, especially to my classmates, the Perfect Vision presidents, our Rotary actors, and all the other guests in attendance, please accept our heartfelt gratitude for taking time in sharing with us your time and insights. And as tokens of our appreciation for your time and service, we shall be giving you a copy of our coffee table book. That's our 50th anniversary coffee table book, which contains our club's 50 years of community service and fellowship, together with a bottle of red wine to enjoy while going through the pages of our book. Once again, thank you, Chairman Benjur Abalos.
Thank you, sir. Thank you.
Okay.
Well said, Mr. President. Before I ask you to adjourn, Mr. President, I'd like to remind everyone to stay on and click on your video button for our photo operations with our guest speaker. Please click on your audio.
Okay,
Okay,
1, 2.
Ron, we're all ready.
Okay. 1, 2. Okay, Dan.
Thank you.
Mr. Press.
Thank you, Director Tony.
Yung ano.
Thank you, everyone, for joining us today. This
An
meeting.
advisory was released to the membership of the different business organizations.
Congratulations,
For the
President
members
Peter.